Alan Reece with Frank and Kraft here again. Today we're sitting with Sandra Dietrich, who is a geriatric care manager and registered nurse with Alliance. Today we're talking a little bit about a different form of home care. In this case, we're talking about skilled care, skilled home care. Sandy, thank you for sitting with us today.
Oh, it's my pleasure. Thanks for inviting me, Alan.
So tell me a little bit about what skilled care is and who might need it.
Well, a skilled home care is more of a medical model, and I think that in order for folks to even have an idea of what a medical model is, I need to start from the beginning and give you a little bit of an idea about home care and how it works.
Okay.
Um, if you've ever typed the words home care company into a search engine and waited for the results, you will find an overwhelming number of companies that you never knew existed.
Sure.
And so the task becomes very daunting to choose. So we always go back to listening carefully to what the family member is calling about.
Okay.
In my experience, I found that it's typically the son or daughter who's calling to say, mom really isn't able to get to the grocery store any longer. She's not able to hit the beauty shop or her bridge game as she used to. And those are things that she really loved. And I'm wondering if you can help us with transportation.
Okay.
They may also typically need a little help with writing a letter to someone, just those little extra touches that are not a hands on situation, but more of a companion service.
A little help getting through the day.
You bet.
Okay.
You bet. And so then we take a step up and we look at those situations where now mom has become a little bit more of needing hands on service. And when I say that, I mean help with bathing, help with dressing, perhaps a little bit of prepping a meal, breakfast or lunch, while that staff person is there. So then we look at more of a custodial type of company, and that would allow them to have a home health aide in the home or an attendant who can provide that care as well.
This is the kind of thing that the same kinds of help you get if maybe you were in an assisted living facility, that kind of help with the activities of daily living, that kind of stuff, getting to and from the tub. Is that right? Or
You bet. It's a little different when we look at home compared to an assisted living in the sense that in a home there aren't surrounding services available to you.
sure, okay,
So that's why we need to bring them in. When you move to that assisted living, which we'll be talking about a little bit more extensively,
sure. In one of our other
then
videos.
then we need to look at what do they supply and what do I need to bring in to assist in that assisted living setting.
So we've gone from companion care, helping just with a little bit of things, and then we've gone to this sort of the next stage, which is, and what's the term for that again? We call that.
It's a non-medical or custodial,
Okay.
more of a hands-on approach.
And then we take another step, and that takes us to today's topic, which is skilled.
Yes.
That's the next sort of level of.
Yes.
Okay. And so what does that look like?
Well, that is what we call a medical model.
Okay.
And typically we see that paid for either by
Okay.
Medicare or Medicaid. But if it's going to be paid for, then we have some hoops that we need to jump through.
Okay.
There's very specific guidelines of what needs to happen in order to receive those services.
Okay.
So, how do these folks receive the services, you ask? And that would simply be it's physician driven.
Okay.
If we find someone in a home setting, and I just experienced this last week, I have a fellow who has Parkinson's disease, and that is an illness that typically has its ups and downs. So as I'm in the home, I always like to make sure that I send them on a task, either to the kitchen or the bathroom, so I can see how they're getting up and down out of that
Oh, I
chair.
see.
Yeah, we're sneaky, and we can see how they're moving and walking across the floor. And in doing so, I'm seeing it took him a couple tries to get up out of the chair. As he was walking, he sort of did a little trip thing. He wasn't really picking his feet up as high as he should.
Okay.
And out of the corner of my eye, I spotted one of those dreaded throw rugs on the floor.
Oh,
Yeah.
big tripping hazard.
It is. And so that brings on that conversation of, so talk to me about how it's been going. You know, I've noticed that you're having a little bit more trouble getting up and down out of that chair. Any issues this past week? Well, then he owns up to the fact that he actually had a fall. No injury at all, but a fall nonetheless. So we begin that conversation of, how do you feel about our calling the physician, reviewing this with him, and seeing what he wants to do. And in this scenario, the physician determined that outpatient therapy might be the way to go for him. And he chose outpatient therapy because he's still driving, he enjoys doing that, and he can actually continue to do so while he goes to his outpatient therapy.
Okay. So if someone's in a situation where the doctor says you may want to look at this as an option, are they gonna be on their own? Is the doctor gonna make suggestions? How's that kind of driven? If how does someone find themselves in a situation of needing to find care, and how do they go about doing that?
Well, the care can be provided also in a hospital setting.
Right.
You know, if our little fellow had had a nasty concussion when he fell, he would have ended up in the hospital.
Right.
So in that hospital setting, then he would have received treatment for that.
Okay.
Depending on how he was coming out of that hospital, he may have gone on to a rehab for even more extended therapy.
Okay.
Eventually, he's going to come back to his home. So there we are, back in that setting of, well, what do I do now? He still is very able to receive home care, skilled home care, where therapists come into his home. So he can do that as long as he chooses not to drive. He under that Medicare guideline, Medicaid guideline.
If he's driving, he's not homebound. If he's homebound, he's not going to get the care at home.
Exactly.
Okay.
Exactly. If he chooses to receive the care at home, then there are numerous options in the way of skilled home care companies. The physician, again, can be the driving factor in who does that care.
Okay.
So oftentimes they will choose the company that's associated with their hospital system simply because they know them well. They have a closer relationship, perhaps. The computer systems that they use link one another, and you know, that can be very helpful. If the physician does not have a preference, then here we go again with this long list of providers, and whom do I choose? And you know, at Alliance Care Advisor, we like to arm our families with a questionnaire, a 5-page questionnaire actually.
Wow.
That can give them questions to ask to make sure that the company that they're using is going to be very skilled at what they do and provide excellent caregivers to them. So.
And what we'll do is we'll put a copy of that questionnaire on Alliance's landing page on the Elder Care channel, so that's a resource that you can download and print off and use in selecting a care provider. And thank you for providing that.
Oh, our pleasure. I will. We've talked briefly about a little fellow needing therapy. Anytime there's any change in condition, as I mentioned, you may have skilled care. If, for example, that fall had taken someone to the hospital, and while there, they soon found out that that fall was caused because the blood sugar was quite high, and we now have a new diagnosis as well of diabetes, and the person is receiving insulin. They are now dealing with blood sugars between 2 and 4 times a day.
Right.
Diet changes. Obviously, there's a great need for education. And so the physician very quickly will order skilled nursing care in the home as well. That nurse can come in and do medication management. Her primary goal is going to be teaching. Not only teaching how to give insulin, whether it's the patient learning or whether it's the caregiver in the home, but also extended teaching about diabetes and the importance of diabetes, exercise, and diet. So there's a well-rounded program of care that she gives when she comes out to the home as well.
Are there any sort of closing thoughts you might want to give people watching this video as they're approaching this kind of issue and trying to either select or work with a skilled care provider in their home?
Um, I think that I will just go back to talking about how difficult it truly is. Our home care system continues to change and evolve on a daily basis.
Sure, and that there's new legislation as well. There's the Affordable Care Act. I mean, it's a very rapidly changing environment.
It is, and so if we as professionals are struggling trying to keep up with it, I can only imagine, and I do see it every day, how families struggle with trying to work their way through this. So, two resources that I think off the top of my head could be helpful. Number one, the physician always and foremost. And number two, you could seek out a geriatric care manager. No matter where you are in the nation, you can simply go to that National Association for Professional Geriatric Care Managers.
For which there's a link and a landing page on the Elder Care channel.
And click on the link for your state and then simply find a care manager. And you will be able to choose from a plethora of folks who can help you with those decisions that need to be made.
Sandy, thank you so much for sitting here and talking with us today.
You're very welcome. It's been my pleasure.
And thanks for joining us.